This morning, the Centers for Disease Control and Prevention announced confirmation of the first case in Illinois of novel coronavirus in an individual who traveled to the city of Wuhan in central China. At this time, the risk to the general public remains low. This is the second confirmed case in the United States, and the individual in question did not get the virus in Illinois. The number of people that she came in contact with since returning to the United States is small. Most importantly, I want to assure Illinoisans that we are closely monitoring this situation and taking every precaution. Our Illinois state and local agencies and officials, along with our federal counterparts, including the CDC, are highly engaged in this coordinated response, including our Illinois Department of Public Health, the Illinois Emergency Management Agency, the Chicago Department of Public Health, the Chicago Department of Aviation, and the Chicago Office of Emergency Management. All of these agencies are working together with other local health departments, hospitals, EMS systems, and clinicians to swiftly respond and to take preventative steps. Illinois has a strong public health system that has been proactively preparing for this situation. As the international status of this virus evolves, I want to assure the people of Illinois that our health officials will continue to coordinate with federal officials in a robust manner to take all precautions and to communicate regularly with the public. In the meantime, I want to advise the public. The same precautions that you take during flu season are the same precautions that you should take for this virus. Take care to wash your hands. Call ahead and then visit a doctor if you're experiencing any symptoms. Our Director of Public Health, Dr. Ezike, and our Director of the Illinois Emergency Management Agency, General Alicia Tate-Nadeau, are both here with me today, and we're happy to take any of your questions on this following today's speaking program.
Thank you, Governor. Again, my name is Ngozi Ezike. I'm the Director of the Illinois Department of Public Health. And I thank Governor Pritzker for his support. As many of you have heard, and the governor mentioned, we just announced the second case of the novel coronavirus 2019 in the United States, and it was in an Illinois resident. We are working closely with the Centers for Disease Control and Prevention, the CDC, the Chicago Department of Public Health, other local health departments, our medical providers, our healthcare providers, EMS systems, for the coordinated and collaborative work on this situation. Because of the diligent work that has already been underway by health professionals and local health departments, we were able to identify this travel-associated confirmed case of novel coronavirus. We identified it quickly while also taking measures to prevent others from being exposed. Because of these coordinated efforts, we believe the risk to the general public in Illinois remains low. I want everyone to understand that this is an emerging situation. This virus is novel, although it bears the same name of known viruses. The strain is different. And as it is novel and emerging, we are still trying to learn all that we need to learn about this virus, both in terms of its symptomatology, how people get infected, the length from exposure to symptoms. All of that we are still trying to master. As we speak right now, we have CDC officials that have landed in Chicago and others that are in the air, that are en route to Chicago, to work closely with the State Department as well as the local health departments and all of the other partners to identify and contain the virus. Earlier this week, we were notified by the Chicago Department of Public Health of this Chicago resident who had returned on January 13, but did not have symptoms while traveling. And in the following days, the individual began experiencing symptoms. I want to notify you that this patient is stable. is stable and currently in the hospital, and we are working with the hospital to identify any other people that need to be assessed. Health officials in Illinois are looking retrospectively to identify other individuals who have symptoms of coronavirus who may have traveled from Wuhan before the heightened airport screenings and before a case was confirmed in the U.S. Again, there are more questions than there are answers. We are learning more information hour to hour and day to day, and our guidance will continue to be informed by the information that we received. Our promise to you is that we will keep the public informed as we work diligently to keep the people of Illinois safe.
Thanks for watching, and if you haven't already, please consider subscribing to our channel. And while you're at it, please leave us a comment. Thank you for watching.